Sure, I'm Jesse Nodora. I'm an associate professor at UC San Diego and at Morris Cancer Center. I'm trained in health promotion. It's a discipline in public health. I'm a doctor of public health. So a lot of the work that I do is in trying to keep people from getting cancer in the first place. So a lot of that falls into screening, so getting folks screened. Well, you know, at a comprehensive cancer center where I am, at Morris Cancer Center at UC San Diego, I would say that much of the resources and the focus is on either the basic science, you know, you're working with tissue, with animals, clinical science, where you're working with patients, therapeutic trials, and then I'm in the population science side. We're a lot smaller. So one of the challenges is trying to really bridge the gap to the other disciplines as well, and being transdisciplinary. I have a session tomorrow that is basically a new task force that AACR has put together on trust in science, led by Dr. Dalton. And so it's basically beginning a dialogue on how we increase trust in science in general and cancer in particular. I think contextually, one of the things that has had a huge impact was the political reality that we were living through the Trump years, for example. This whole notion of fake news and really the divisiveness that created. And there are individuals who otherwise probably wouldn't think twice about distrusting government or science and so on. That context has really influenced. And then the pandemic, there were some missteps early on, I think, in terms of information, how soon we were going to move towards vaccination, for example, and really trying to disseminate resources equitably. That, you know, there's some stumblings there, even in our own state like California, right, where you have a lot of community focus. Yeah, the task force just started. Actually, this is kind of our debut here at this meeting. We've only had one formal meeting, and the approaches that we use have yet to be defined. But I was brought on largely because I do what's called community engaged research and work with communities in terms of defining the issue that's being looked at and really working towards solutions and partnership. And I think the same kind of approach needs to be used with the work that's being done in this task force, yeah. Yeah, it's critically important. The downside, though, is when I was talking about being able to explain things or being able to have a dialogue, because it really is having a dialogue, right? With a 5-year-old or your grandmother, you have to reach common language. You have to be very clear about key terms that you're using and so on. So that's one piece of the communication. It's not like a one-way communication, it's a dialogue. And then there has to be what's called cultural humility in terms of that dialogue. Scientists don't know a whole lot about community and what's really going on there. And in the same way that the community may not feel like that they know a whole lot about what's happening on the science side. So from both sides, you kind of have to, particularly on the science side or the educated side or whatever you want to call it, we have to be much more humble in terms of saying, acknowledging, not saying, not giving permission. It's not about permission, it's basically acknowledging that the true understanding of community is by leaders in the community, right? Not us. So they're going to teach us, they're going to train us, and I think that's the approach that has to be used. I think that it's an opportunity to really move the needle a little bit in the area that I'm most passionate about, which is prevention. And quite frankly, cancer, if you're at this meeting, like I said, clinical and basic science dominate the dialogue. population science, and particularly in prevention, in our society, in our culture, does not dominate the dialogue. The majority of money for health research or services does not go to prevention. It's not about keeping people from getting the disease. It's about treating you, diagnosing you, and treating you once you're on your way towards that disease. So the trust and science dialogue, I think, certainly that's what I'm going to try to bring in, is some of that, early prevention kind of perspective on it. Yeah, no, it's well known. The key things you need to know about cancer are that the risk, the likelihood that you're going to get cancer is, like from the genetic perspective, things that you can't change, you can't modify, it's only about 10%, 15%. The majority of the risk, and it's 60, 70% of the risk is actually preventable. And that is things that you're going to be exposed to. And there are 5 things that you can do right now to reduce your risk of cancer. And everybody knows them. And it's not just related to cancer, it's related to chronic disease, heart disease, cardiovascular disease, diabetes. At the top of that list is tobacco, not using tobacco, moving. And I'm not going to say exercise. You don't have to go hit the gym. You just need to go walk around the block, right? Moving, eating well. Eating well, that's a very, very complicated thing because of not just us, but what's around us. As children, we're being, the TV is pushing you towards those frosted flakes, right? And as an adult, you're being pushed towards the Big Mac, supersize. So, the nutrition, the activity, the vices like tobacco, alcohol. And then the other thing is certain cancers are totally preventable with vaccines. For example, cervical cancer to a large degree, head and neck cancer, they're related to human papillomavirus. And so you can basically do that. And then also, when you reach a certain age, you should start certain types of screening. And doing that, cancer, by and large, grows very slowly. And the earlier you catch it, the more treatment options you have. That's also part of prevention. So all those things put together can really have a much more positive outcome.